Hi, I'm Amit Pandya. I'm a professor at UT Southwestern Medical Center in Dallas, Texas, and I also have a vitiligo center.
So we're going to have him answer questions that patients had submitted. What is the connection between vitiligo and thyroid problems?
Well, vitiligo is associated with thyroid problems because both are autoimmune diseases. There's 54 genes that have been identified in patients with vitiligo, and most of those genes have something to do with autoimmune diseases. Now, there's like 60 autoimmune diseases. Thyroid disease is the one that's been associated most with vitiligo. 15 to 20% of patients with vitiligo do have thyroid disease during their lifetime. Now, treating the thyroid disease doesn't necessarily make the vitiligo better, and treating the vitiligo doesn't necessarily make the thyroid disease better. In fact, one can be really bad and one can be stable, and vice versa. However, because thyroid disease can kind of sneak up on you, I recommend to my patients to just have a very easy to perform screening blood test that every doctor knows how to do to check for thyroid disease once every year or two to make sure it's not coming.
Okay. The next question, does stress make vitiligo worse?
Well, it's just really hard to study about stress. However, many of my patients have told me that stress, they have noticed that during times of stress, their vitiligo got worse. Now, we know that during times of stress, there are molecules in the blood called neuromediators and also cytokines, and they go to the skin, and they've been found more in the skin of vitiligo patients than in patients without vitiligo. And so therefore I do believe that during times of stress there is a potential for vitiligo to get worse. So I think when someone is undergoing vitiligo or has vitiligo, if they feel like they're having signs of stress or depression, especially physical signs like lack of sleep, weight gain, weight loss, or just lack of interest in their normal day-to-day activities, they might want to consider talking to the doctor, certainly ask family members if they've noticed these type of symptoms in them, and talk to their family doctor. They may need to see a counselor, they may need to see a psychiatrist to get on medication. All of those things can help to bring down stress, take depression away, which might help with vitiligo. It's hard to prove that, but I think it's a good idea to try to reduce the amount of stress in your life with different methods.
And that's anything in life.
Right. Right.
Any dietary recommendations or restrictions for patients with vitiligo? This is a huge question that gets asked.
It's a huge question, and I know that there's a lot of anecdotal reports where one person gave up something and their vitiligo got better, or one person started something and their vitiligo got better. But we as scientists do what's called controlled studies, where if something really was going to make a difference, we'd like to put 50 people on that food and 50 people do not go on that food, and we follow them over a year and see which ones vitiligo got better or worse. Most of those studies have not been done with every food. There are some vitamins that seem to help vitiligo. These are antioxidants. Now, antioxidants are found in fruits and vegetables and almonds, for example, or nuts. And so I tell my patients that it's a good idea to live a healthy lifestyle. Try to have 5 servings of fruits and vegetables every day. And a serving is just 4 ounces. 5 servings of fruits and vegetables every day, a handful of almonds, and that's going to give you antioxidants. Now, should you take vitamin C, should you take vitamin E, should you take ginkgo biloba, these are antioxidants that have also been shown to help reduce the oxidation state in the skin. But I don't think it's necessary to take really expensive medications. I think very simple multivitamins with a small amount of vitamin C, vitamin E, perhaps ginkgo biloba. Those are the things that I have seen in the literature to be associated with improvement in vitiligo.
What about a probiotic?
I think probiotic is going to help the bacteria that you have and make your bacteria normalize, but there really has not been a link between antibodies against the bacteria in your gut, which are usually IgA antibodies, and vitiligo in the skin. We don't see IgA antibodies in the skin. However, I think probiotics are very good for people to normalize your microbiome.
Okay. Next question, can you be too old to start vitiligo treatment?
You know, it's interesting that vitiligo can occur at any age. It's more common in people under the age of 30. But I certainly have patients who said, "Doctor, I was doing fine, and when I turned 65, I got vitiligo." And it's similar in those patients like it would be in a 15-year-old. You have immune cells coming in and killing the melanocytes. If immune cells are coming in and killing the melanocytes, they should respond to treatments such as creams, pills, phototherapy. So I don't think that you're too old to get treatment for it.
Okay. What are the best treatments for individuals with segmental vitiligo?
Segmental vitiligo is a unique form of vitiligo in which once you get it and it stabilizes, which usually takes 2 years, then it pretty much stays like that for the rest of your life. Now those patients, I believe, you should start with phototherapy. The phototherapy will help bring in some of the color from the margins. Then after that, I think a transplantation of melanocytes to the area, whether with punch grafting or cellular grafting, is really the best treatment for segmental vitiligo. Creams like tacrolimus and topical steroids can help a little bit, but I think phototherapy and transplantation are the best treatments.
Now, and you talked about at the conference having kind of a trifecta of treatments, having the phototherapy, having possibly the creams or the steroids, and then having the good diet. Why is it important to have all three or two or of that?
Right. Well, we know that vitiligo has two main pillars. One pillar of therapy is to remove the bad cells. And you remove the bad cells by using creams like tacrolimus or steroids. And if you have a lot of active vitiligo, you may need to take some oral steroids intermittently for a few months. That's to remove the bad cells. The other pillar of therapy is to stimulate the good cells, the melanocytes. For that, phototherapy is the best thing. Now, some people say there's a third pillar, which is antioxidants. And antioxidants stop the trigger for vitiligo. So I would say those three pillars, antioxidants, medications to remove the bad cells, and phototherapy to stimulate the good cells are the three pillars of therapy.
Okay. Is it safe to treat the genital regions, and what are some special considerations relating to treating this area? Good questions.
Well, genital regions definitely do develop vitiligo. And I think if you can catch it early and treat with some of the creams I talked about, it can help stop the vitiligo from spreading in the genitals, and it can even reverse it and make it better. When it comes to phototherapy, the reason that we are reluctant to use phototherapy in men is because back in the 1970s, a different type of phototherapy called PUVA was used on men and women with psoriasis, and these were mainly light-skinned patients from Boston, Massachusetts, and a certain number of those men, a few of them did get carcinoma of the genital region. And because of that, even though now we have much safer forms of light, because of that experience long ago, it is not recommended that men's genital area be treated with light therapy, even with the new safer lights. Women, it doesn't seem to be an issue. So I think treating genital area with topicals is fine. Treating it with light in women is fine. Treating the genital area with men, we still don't have the data on that with the new safer narrowband UVB light.
Okay. Why do treatments work so much better on the face and hands, and what treatments do you recommend to repigment hands?
Well, first of all, the face has a lot more hair follicles. The nose, for example, has 400 follicles per centimeter. The back has only 80 follicles per centimeter, and this area, the chest, only has 30 follicles per square centimeter. That's why this is so hard to treat. Of course, fingers have no follicles. There are follicles in the back of the hand, so you'll often see people getting better up to about right here where they have follicles.
Yep.
But this area doesn't. They may have a few tufts of hair, so they'll get some pigment here. But the knuckles and the tips of the fingers where you don't have follicles, you don't get better. So it's lack of follicles, which is the reason why we have so much trouble on the hands. So we are doing research to try to develop ways of taking melanocytes, for example, from your hip and inserting them into the area of your hands so that those melanocytes can start growing when you're using the phototherapy. So what I'm hoping in the future is that we can treat hands with phototherapy for maybe a few months, put the melanocytes into the area, and then continue the phototherapy so that the melanocytes will grow into the area.
Okay. What do you think the most misconception of doctors and vitiligo, and maybe patients thinking that doctors are only out for a buck or don't really want to treat the patient?
Well, I think
that makes sense.
I understand, and I think that it's unfortunate that many patients have that impression. And I think one of the reasons is because we don't have enough dermatologists in America. We have 350 million people in this country, and we have an epidemic of skin cancer. We dermatologists are unbelievably busy trying to remove cancer from people's skin and all the various skin diseases that we have to deal with. Vitiligo is one of those skin diseases, and it's certainly important. However, I think the volume of the other work and the other diseases causes dermatologists to not be able to focus so much on vitiligo like some of us who dedicate our whole lives to it. So there's just a few centers in America where doctors have elected to dedicate their whole lives, or at least a good portion of their lives, to it. And so when you see the contrast between people like me and doctors who are just being a dermatologist in the community, a lot of people get that impression that the dermatologist may not care or may not have that knowledge about vitiligo. I think overall what we need to do, as those of us who are specialists in vitiligo, is we need to do more lecturing, more publishing, and more outreach to our dermatology colleagues so that we can announce all the exciting new treatments that are happening.
Absolutely.
I think there was a question on
Ginkgo?
Ginkgo
Oh, yep,
biloba.
ginkgo, yes.
Ginkgo biloba, there was one study in which they gave ginkgo biloba to the patients, I think 40 milligrams 3 times a day, and another group got placebo. And these were patients with very mild, slow-growing vitiligo. And the people who took ginkgo biloba, they noticed that their vitiligo did not grow as fast, or it kind of stopped, and about half the patients noticed some improvement. So there may be some evidence that ginkgo biloba does help. However, I would not bend over backwards and spend a lot of money for it, but there is some evidence that it seems to help.
So why don't you just wrap up saying about the future of vitiligo and where it's heading?
Well, the future of vitiligo is exciting because now we've learned so much about what causes it. The researchers that are at this conference have told us about the inflammatory cells that are attacking the melanocyte, and now in that pathway we have multiple targets that we can attack to stop that inflammatory pathway. There are several companies here that own those products, and they are studying them right now that stop that pathway that leads to the destruction of melanocytes. On the other pathway, which is stimulating melanocytes, there's a company here that has a product that can do that, and then another doctor talked about an exciting new molecule that turned the skin in her laboratory brown because the pigment came in. I'm very excited about these two pillars having new therapies in the future, and hopefully within the next 6 months we'll be able to announce the results of our first study on a JAK inhibitor, and then over the next few years we'll be able to give you lots and lots of reports of all the studies that are starting up. So I'm very excited about the future of vitiligo.
Very good. Well, thank you for taking time, and we'll see you later.
All right, thank you.